We begin tonight with the class action lawsuit against the city of Buffalo and Veolia Water, the private company operating the water system. It claims that people living in Buffalo were deprived of the health benefits that adding fluoride to the water provides. Buffalo used to fluoridate its water, but stopped in 2015 to upgrade the water treatment system without, according to the lawsuit, properly notifying its residents. Now, the CDC has just released a study which bolsters the claims made in the lawsuit about the benefits of fluoride. And we're operations at SUNY's Buffalo School of Dental Medicine. Dr. Dowd, a key finding of this new study is that properly adding fluoride to water reduces tooth decay by 25% in children and adults. So that certainly seems positive. But how significant is that in the grand scheme of our dental health, and what does that number actually mean for most of us who don't do what you do?
Well, Kate, that point that you made is very true. That the study's just confirming many other studies that have done the same thing and confirmed those results. Reducing cavities by 25% can have very dramatic effects on oral health as well as overall health. And we are concerned that it's been 8 years since there's been fluoride in the water in Buffalo. And we're concerned there's a generation of kids who have lost that extra supplementation that's important for them as far as their oral health.
And the CDC's study also found that fluoridating water saves people $6.5 billion in dental bills by preventing tooth decay, things that might require fillings or getting a tooth pulled. So if someone lives in a place where they don't have fluoride in the water, I know you said you're concerned about that, is there something that they should be doing to make up for what's not in the water?
Well, it's very difficult sometimes, especially for disadvantaged folks, if they if they don't have a dentist, or they haven't been to a dentist in a while, or they even can't afford toothbrushes or toothpaste, for them to make up for that lost fluoride that's equally distributed around a community for everybody. But I would, there are things that dentists can do as far as giving fluoride supplements that you take daily if you are in an area where there isn't fluoride supplemented in the water. So there are dentists out there, and if you go to your dentist, you can ask them, especially if you live in Buffalo and you see a dentist, ask them, should I have a supplement as far as from fluoride, because it isn't in the water.
Let me ask you, doctor, because there may be some people who aren't seeing a dentist. What about them?
Well, it concerns me greatly. I agree. I mean, the fluoride in the water, and I can't stress this enough, it promotes health equity by equally distributing effective and safe fluoride supplemented water to everyone in a community. So the fact that we don't have that in Buffalo is a really major concern. And for 8 years, that's a long time. Like I said, a generation of kids who are without it. So, I mean, I try to stress to anybody to find a dental home. There's dentists out there that will see new patients. The University of Buffalo will see new patients at any time. I think it's important that people do get a checkup 6 months or one time a year. But for those disadvantaged folks, I mean, they can call our district dental society or the school, and we can help them get in for an exam and to help with supplementation for them or for their kids.
And again, the city says that it won't resume adding fluoride until the end of this year. And we mentioned that the class action lawsuit against the city. What does that study now mean for the people who are suing, and how might it help them?
It's just confirmed a number of studies that have gone on in the past 30 or 40 years about fluoride in the water. Fluoride in the water has been around since 1945. It started out in Grand Rapids, Michigan. So that's over 75 years ago where we've had multiple studies over the years that have proved its effectiveness. This is just another study confirming that the reduction in cavities of 25%. So it just is another strong indicator that the city of Buffalo needs to get moving on this. They need to get fluoride in the water as soon as possible. And we have stressed that with them in our discussions with them.
And you mentioned this is also a question of equity as well.
Absolutely. What better way than to distribute water with fluoride in it equally to everybody in Buffalo? Whether you're from a poor community or a better off community, the same thing. You're receiving that benefit. And that oral health equity affects your overall health. There's loss, for kids or adults that have cavities, that lose teeth, or that have tooth pain. You're talking about lost school time, lost work time. It affects their overall health on top of it. So it's really something that I'm a little perplexed, to be honest with you, that it's been going on for 8 years, and I think it's something that they need to get moving as soon as possible. I can't stress that enough.
Well, we appreciate your perspective. Dr. Brendan Down is the Assistant Dean of Clinical Operations at SUNY's Buffalo School of Dental Medicine. Thanks again for joining us.
Thank you for having me, Kate.